there is increasing data that those who are vaccinated can still acquire and transmit the Delta variant particularly. The original strain of COVID seemed to be less transmissible among those who are vaccinated, but the Delta variant does appear infectious enough that even those who are vaccinated can pick it up. The vast majority of those people remain asymptomatic, and the vast majority of those people have at most mild symptoms. So, in terms of transparency, I share this story frequently. I am one of those cases of a breakthrough infection. I was, as you all know, one of the early people to be vaccinated. I was vaccinated as soon as it became available and appropriate for me to do so. And I'm very careful. I wear my mask in stores. I wear my mask at the grocery store. I'm very careful. I did follow the CDC guidance once they said you didn't need to be masked among others who are vaccinated. And so truth is, I don't know where I acquired COVID, but I had some mild symptoms, feeling of sort of congestion, a little stuffy. So I got tested and it was positive. So I followed the rules, I quarantined. And over the course of that quarantine, I was symptomatic personally. I had a fever, I had some myalgias. It was not pleasant. It felt like the flu. But at no point did I feel concerned for my safety. And that I think is the real difference, right? I was one of those very rare cases of a symptomatic breakthrough infection. Most are asymptomatic or extremely mild. People may not even know that they're infected. I do encourage you to get tested if you have any kind of symptoms. There's a lot of kind of summer cold stuff going around. Get tested if you have any symptoms. Don't assume that it's allergies, as I almost did. But yeah, so I was a breakthrough infection, and I share that frequently because I want people to understand that it does happen. It's a very real thing, and it wasn't pleasant, but I felt at no point that my well-being was in danger. I was like, I know I'm going to be okay. I know I'm going to get better. But when I felt my worst, I'll be honest, I was sort of thinking about what that would feel like to feel that way and not be vaccinated and not know if you were going to get better or worse the next day. And that could be a very, very scary feeling. So being vaccinated, I recovered more quickly. I was back on my feet very quickly. And certainly very, very glad to be sitting in that seat vaccinated rather than sitting in that seat unvaccinated. So breakthrough infections definitely do happen. The data looks like the infectious period is shorter. So the sort of the viral replication may be better at hiding from the immune response. So the Delta variant, as I talked about, those changes to the spike protein, it may actually have some sort of shielding around it as well. If you speak of some, sugars that blind the immune system a little bit in terms of their response, that gives it a brief window to get in and replicate. But the vaccines do ultimately provide a high degree of protection because the immune response does ramp up. It does shorten that period. So that's based on what we know now in terms of the data, but it looks like you do become infectious if you pick up Delta, but you're infectious for a shorter window than you may have been if unvaccinated. So breakthrough infections do happen. They still continue to be rare, right? There aren't a lot of them. The vast majority of people who are vaccinated are not demonstrating breakthrough infections. And the good news is of those who are being hospitalized, and we do continue to see hospitalized COVID patients in Jersey City, almost all of them are the unvaccinated population, right? It really provides excellent protection against the severe cases that end up in the hospital, right? And again, personally, at no point did I feel like I was going to become one of those cases, right? I felt crummy. I was infected with COVID, but I did not feel like I was going to be, at any stage needing to go to the hospital for it. And that's certainly a lucky place to be.